We know that homeopathy stimulates our vital force. What we essentially want to do is to support our vital force so we can go more easily without so many side effects through the procedure, and that the body can work for us in that sense. So homeopathic remedies are supporting your vital force so you don't feel so much pain, your recovery is faster, and you don't feel so distressed, which is one of the most important things. And yes, what do you do when you have that fear or suffer from anxiety before procedure? And how do we find that homeopathic remedy that can help you? We use the method, which you might have.
Today's guest is one of the lovely homeopaths on my team, Jagoda Salewska. So Jagoda will be sharing with us some homeopathic remedies that can be used during dental procedures. You can also learn a bit more about Jagoda at another episode that I've done with her, which is episode 277, as well as episode 243. So to book a consultation with Jagoda or learn more about her, visit jagodahomeopathy.com. You can also visit my website, eugeniekruger.com, to learn a bit more about Jagoda over there. Thank you so much for listening.
Welcome to the Homeopathy Hangout Podcast, where we discuss all things homeopathy from around the world. And now our mum and your host, Eugenie Kruger.
Hello, homies, and welcome back to Homeopathy Hangout. And today we get to hang out with my really good friend and one of the homeopaths on my team, the one and only Jagoda Salewska. Welcome, Jagoda.
Thank you so much, Eugenie, for having me again. And it's a great pleasure to be here and hang out with you and other homies who are listening to your amazing, amazing podcast. You've been doing such a great job sharing your knowledge and others' experiences and homeopaths' work in your podcast and bringing homeopathy closer to really homes of so many people.
Oh, thank you, Jagoda. Now, I was just thinking, you've been on the podcast before, but I actually a couple of times, because we're now in our group ones and also your own one. I have to go look up the episode numbers now. But if you're listening on Spotify, just go in Homeopathy Hangout Podcast and type in Jagoda at the top there, and her other episodes should come out. And what is extra special about Jagoda is that she's actually a conventional pharmacist turned homeopathic pharmacist and homeopath. And she is my go-to gal for our homeopathic dispensary here in Perth. If I ever need to know anything or I'm unsure of something, she's my first person that I call. So not only has it been amazing to have you on our team has it been 3 years yet? It feels like it must be about 3 years that you've been on the team. At least a couple of years anyway.
Yes, a couple years in September, actually, yes.
Yeah, yeah. And it's just been lovely to have you as a friend and a, fellow team member on Team EK. So it doesn't even feel like a podcast recording. It just feels like us hanging out, which is awesome. But we have to just say that Jagoda has a couple of Facebook groups that she helps to run along with some other homeopaths. And one of them is the Homeopathy for Teeth Facebook group, which how many thousands of members have you got now?
35.
35,000! Oh, that's incredible. Amazing. And there's so much you can do for teeth with homeopathy. So,
yeah, homeopathy for teeth is still a little bit gray area because we understand that we are a whole person, but certain areas are not so well, not discovered, or maybe because, yes, we are not dentists, first and foremost. We are homeopaths, so we want to know sensations and symptoms. However, when it comes to teeth, yes, we want someone to look into them. But there are so many great remedies that can support you through procedures, like dental procedures. And there are so many connections with teeth and meridians. And I think we touch on that in the first time when we talk about how much input you can get from looking what specific tooth you have issue with, and then what's the organ connected. And looking, is the problem in the organ or is it problem in the actual tooth? And bringing the awareness of that is so important because unfortunately, some dentists still treat as teeth are stones in your mouth, nearly, because they see that connection or they don't bother about that connection, where emotions often they bring the issues with the teeth to the surface. And often we need to address the emotions. And as a homeopaths, we can see how, outbursts of anger or something else can trigger things in the physical symptoms. And that's a simple example, like Staphylococcus aureus will be remedy when you feel pain and you are better or worse on chewing. And Staphylococcus aureus is a great remedy for when you get really cross with someone. And then you can find that relation with the teeth. And if the emotional trigger was there, use the remedy to help you to resolve the teeth issue as well. Not only your emotional state, but also the physical presentation of it. So, yeah.
How did you, because you somehow have niched yourself into teeth and dogs. And I just also have to say that any kind of teeth and dog cases, I send straight to Jagoda, because she also does dog coaching, which, I mean, they have to use the word coaching because obviously they're not vets. But I have had so many incredible testimonials from clients of mine that I've sent to you with their dogs. I just have to, I know today is all about teeth, but I just have to say, you have any issues with your dog, go and see Jagoda. I've lost count of how many amazing testimonials I've had of dogs that she's literally saved. I can say that. I'm allowed to say that. You've done amazing, amazing work. So just on behalf of all the furry friends, I just want to say thanks.
Oh, that's so awesome to hear. Thank you so much. Yes, sometimes we don't hear about good results. Like if you help someone, you sometimes don't hear if you did. But yeah, that's great to know. And yeah, the dogs is something I find challenging, but at the same time, this challenge is like great because you can really look as, for example, when we treat children, we also don't know a lot about their emotions if they are like little children, little babies. But we can take the observations, and then the observations are leading you to the remedies. And the best thing in treating babies and dogs, there's no this placebo effect because they don't know what we're giving them. And if it helps, it helps. If it doesn't, it doesn't. And with dogs, the award is also that they often present the symptoms of the owner. So the starting point with treating the dogs is often leads to the person also healing. So it's like double win. And we can really do so much with simple ailments for dogs that unfortunately the vet stuff is quite toxic for, like even fleas. You have amazing combinations on your website, and the dog kit that can be without even having a dog coaching, you can easily start this way, so you can start doing deworming, you can start doing this, you can start doing other things just by simply having a kit at home and following instructions. And then when obviously there are more complicated things, and often in dogs, what I see is some issues with the muscularies and limb system. So they might be having some issues with walking. Skin is a big one, but that often is to do with food and environmental toxicity.
Yeah.
We put them on a liver detox and some other detoxes, and that release the skin, and then they can just be happy and not have more symptoms.
Thank you for that plug, by the way. Yes, you can hop on eugeniekruger.com and get the doggy kits. Just type in the word doggy and it will come. Thanks. I always like a free plug. But today is all about dental surgery because we get so many emails asking for advice on dental surgery. And so I actually said to Jagoda, can you just please send us let's do a podcast episode so we can just send people to that and they have all the information there. It's a big thing and people want support around this. So Jagoda has even prepared a PowerPoint for us. So if you're on rumble.com, you can see it on there. I don't like to say the other one that starts with a Y that ends in a tube, but you can go watch it there too. So you can share the screen with us, Jagoda, but for those just listening on the audio, you won't need the slideshow. We'll make sure that we spell it all out for you so you can continue driving and listening or walking your dog while you listen.
For joining. And yes, Homeopathy for dental surgery. Let's start it. So just disclaimer, which is just something to say that we are doing here education and trying to empower you. But at the same time, if you need to go to your dentist, please do so, because it's essential to have kind of idea what's going on in your body. And Homeopathy can support you through the process when you do have a treatment. And what I will cover in this presentation will be anticipation and fear before the actual visit to the dentist. And we are talking about the dental surgery today, but obviously remedies for anticipation and fear and worry before any medical procedure will be similar. It's just about how you react to the situation. Discomfort with prolonged dental procedure, preparing your body for extraction, the top remedies for post-tooth extraction, pain and bleeding that's often associated with extraction, possible infection, and what do we do beyond that and what's possible. And that's my references for the presentation. And we know that homeopathy stimulates our vital force, and that's what's important, and that's what we touch on at the very beginning, that we are the whole person, yes? So we are supporting the teeth, but what we essentially want to do is to support our vital force so we can go more easily without so many side effects through the procedure, and that the body can work for us in that sense. So homeopathic remedies are supporting your vital force so you don't feel so much pain, your recovery is faster, and you don't feel so distressed, which is one of the most important things. And yes, what do you do when you have that fear or suffer from anxiety before procedure? And how do we find that homeopathic remedy that can help you? We use the method, which you might have seen before in many other opportunities before. We use clams. And I find this method very important, but I realize often that we know as homeopaths what that method is, but not necessarily people who even are familiar with homeopathy do understand fully what it is. And we are always pressing on that. But sometimes it's our role as homeopaths to make this easier, yeah? And clams is great, but that often works better if you do consultation and then you ask those questions to your patient, where sometimes patients, they don't have so much time and they just want a quick resolution here. And with the anxiety and fear, AAA will be your first port of call, and it will not require looking at so many modalities, concomitant, and so on. If you don't know what to take before dental procedure, just go for AAA. AAA stands for aconite, which has a great fear of death, anxiety and worry, restlessness, acute panic attacks. Arsenicum, which also has a fear of death and disease, is exhausting for the person and difficult to reassure them, but better with company. And archnid, fearful, hurried, nervous, and impulsive. The stools are very typical for archnid, and they are very much better for fresh air. But again, you don't necessarily need to have all the symptoms mentioned. And if you really don't know to choose one remedy, just combination AA might be something that you go for.
I've just realized when you said clams before, the ones who were just on audio wouldn't have seen that. So clams is an acronym we use for concomitant, location, etiology, modalities, and sensation. So for anyone that is just on the audio only, that's usually what we would look on. Like, what is the thing that caused it? Where is it? What makes it better or worse? Is there anything that goes with it? What is the sensation of it? So usually that's the ideal situation. But listen, at the end of the day, sometimes you need to go in for emergency surgery, whatever. You don't have the funds or the time to get to a homeopath. And then a combination remedy like this AAA that Jagoda has just mentioned can be really helpful. And so it's a combination of those three, the aconite, the arsenicum, and the arginate.
Yeah, and they will be usually easily available as well. So other remedies, if we would have more time for preparation to consider for anticipation and fear, would be pastilla, phosphorus, ignatia, gelsemium, lycopodium. But then again, we would have to go back to clams and see more if you are really clingy and whiny and you want support, or you actually just want to be left alone, or you're crying so easily and you are emotional, or other things that you present, and then that will be that one peculiar thing that, this remedy, like your muscles are very weak, yeah? And then we will say, gelsemium probably would be a good one for you.
That was for me. Like, my legs turn to jelly when I think about going to the dentist, and Gelsemium, I used that, must be like 11 or 12 years ago. I had a wisdom tooth pulled, and Gelsemium helped me to stay so calm. I cannot believe the difference it made. It was wonderful.
Oh, amazing. My go-for is arginine, actually.
Aren't we lucky to have these remedies? Like, it's just so wonderful.
Yeah, I didn't have to use before dentist. I don't have a fear, but when I was doing the learning to how to drive, for example.
Yeah.
And those fears, as I said, those remedies can be used in any anticipation and fear situation. If it's a fear of flying, fear of, I don't know, going somewhere else to the other medical professional, that you can use those remedies in any situation. They are just there and can greatly help you through the process.
Absolutely. Any sort of exams or anything like that. It's so wonderful.
Oh, yes. Exam situations. Yes. Yeah. Driving license exam.
Public speaking.
Yay. Archie today, Bo.
Yeah.
So, how to make your tooth extraction smooth? Because it can be really overwhelming. Like you said, wisdom tooth is one of them that we might go through as adults. And that's extraction, which usually is not emergency, but it might be if there is a severe pain. So we might have time to prepare ourselves for it. And it can be really nerve-wracking because you don't know how it's going to go, if you're going to have pain. And obviously losing your tooth is the whole other aspect of it. Making it smooth, it really can change how you feel. And there is a jewel that can help. And I think it's what I did the research. They are worth more than a gold sometimes. And they as rare as diamond and shine like one. And the remedy is emerald. And it's a great remedy that can really make your extraction easier. It helps the nervous system to calm down and smooth the process of extraction. It like allows the body to just the tooth to be taken out.
You just give that beforehand, hey?
Yes.
Like, do you have a preferred potency that you'd normally use that in?
I would go for 200.
Okay.
200.
No, that's good to know. I often give it in 1M, but actually 200 might even be better. But I heard Colin Griffiths say once that emerald helps the body to let go of the part that it needs to let go of, like, in this case, a tooth. And I've definitely had great success with emerald as well, giving a dose of that. Like just one dose. I know I personally usually just give one dose beforehand, but do you give it more?
I would say you can give one first thing in the morning when you wake up and the extract, and then just shortly before. So like maybe couple doses.
Okay.
I had a case of the patient who really couldn't get emerald on time. And what she did, she had the emerald stone as the pendule. And she was holding onto it during the extraction. And that also helped her. So,
beautiful.
It's great. And the energy of the crystal is in a crystal itself. So you can help yourself. I mean, yeah, we would like you to try the homeopathic remedy, but if that's not time-wise, sometimes it's the thing, yeah. But you have emerald on your website, no? I've seen.
Yes, yeah.
So it's a really great remedy too. And yeah, 200 or 1M, I would say you go higher than lower. What do we do if, let's say, sometimes there might be a complicated and long procedure during the extraction or some other work in your mouth? It doesn't have to be extraction, but actually prolonged work. Sometimes it might happen when you have, let's not wish for, but some people decides for root canals and your muscles get so much tension in your mouth because of the prolonged open mouth. No? So when MagPhos is something that you can support yourself through that process. And some dentists are okay. I mean, they give you water to rinse your mouth in between whatever they do. So you can actually drop the MagPhos there. The other option is if you have a liquid potency, just drop a drop under or 2 drops under your tongue and help that muscles. Obviously use it regularly as well because it's a great salt to use generally. And it's one of the 5 top cell salts for the teeth. And everyone is deficient.
Yeah, I can confirm that out of more than 400 Lego scans that I've done, I have not seen one single person whose magnesium was in the green, like on the right-hand side of the scale. Everyone is low.
Yes. And actually, the best way to replace magnesium is through the skin. But yeah, not often we have opportunity to go to the sea every day. So using salt salts, using some oils, lotions or using Epsom salt baths, things like that. But it's such a great salt. And the correlation also with iron, you know probably much more about that correlation, that it's also related with ion absorption, magnesium.
I have not heard of that, actually. So you're going to make me go down that rabbit hole now. That's interesting.
So magnesium and copper are both related to how absorption of iron is there. So being deficient on magnesium also affects your iron. So
interesting.
Yeah. So great salt to use. And then what do we do when the actual procedure is over? What do we need? And I came up with little acronym clash with the remedies that whoever watches on the screen can see the little pictures. And the acronym stands for calendula, for C, which helps healing of the gums post-extraction, prevents the actual infection, also helps with the cutting and stinging pains. And it can be used as a homeopathic remedy. And also I will mention that at the very end, but will also be used as a hypercal because calendula in a form of tincture also is so powerful for the gums, and that prevention of possible infection is so important because nowadays 70% of people who would have extraction or more will leave the dental office with the prescription for the antibiotics. Some people choose not to take them, but it's not a choice, take or not. You need to do something instead. If you don't want to take antibiotics, I truly support that decision. But yeah, prevent the infection, because the possibility of infection is very high when you have an open wound. Is no-brainer, no? Lidum, so puncture wounds, and that often because of the anesthetic injections you get before or during the procedure, and the wound is better from cold. Arnica is our go for any traumatic procedure, but specifically for dental procedure as well, where you have inflammation and soreness and bruised feeling in your gum. Staphylococcus aureus, when often with the wisdom tooth you might need incision and they might need to cut out part of the gum, or they need to cut part of the bone or something. So with the extraction, during the extraction, and wounds are lacerated, stretched, you have a feeling in the gum that you have the cut. Sometimes they even put stitches. That will be a great remedy to use. And Hypericum, which is for post-dental pain due to the nerve damage. So you have the shooting pains, sharp pains. Hypericum is better for lying on the face. And together with calendula, they make a great duo to use as a hypercal to prevent those infections. So the top 5 remedies I feel like you should have in your cupboard are calendula, lidum, arnica, staphylococcus aureus, and hypericum. And you might not all 5, but the top ones would be probably arnica, calendula, hypericum. If you didn't have injections, you don't need lidum. If you didn't have stitches, cut, you don't need staphylococcus aureus. But yeah, those were the top 5, I feel.
And as you mentioned, like the hypercal mother tincture, which is hypericum and calendula, I mean, we have probably sold thousands of bottles of that over the years. I've been selling it since probably about 2012. And I am so grateful I learned about hypercal mother tincture. We use it in a diluted form. You can rinse the mouth with it, but gently after, if you've had like an extraction, especially if there's stitches, just very gently swirling it in the mouth. It's great after giving birth. If you've had an episiotomy or there's any tearing, using the diluted hypercal, putting a menstrual pad in there, just holding it on the genital area for, 10 minutes at a time, 3 times a day. Our pets on the farm have, injured themselves. Hypercal has healed it. My son split his knee open, hypercal in there. Any sort of, even if there's like infections, any sort of infections on the skin, it's unbelievable. Everyone should have it in the house.
Yes, for any.
Yeah. I used to use a lot of colloidal silver years ago. And, since I've had hypercal, I just haven't used colloidal silver. I mean, colloidal silver still has its place, but I just find hypercal is so incredibly effective. And it heals wounds. Like, if you didn't see the photographic evidence, you just could never believe how fast it can heal a wound. And I've got a few reels on my Instagram where I've taken daily photos of the pets as the wounds have healed and of my kids. And then I'll put it into like a little time lapse, almost like a progression. And you can just see the wound just heal unbelievably without any complications and without any need for antibiotics or anything. Okay, that's my hypercal rant.
It's amazing. And it tastes nice. It's not, some things are a bit unpleasant. Like I find colloidal silver way too strong, like when you use it even diluted. Where hypercal has a nice, just herbally. It's a great also, calendula specifically, some people are complaining about the pockets in their gums. It can shrink the pockets in the gums as well.
Wow.
When it's used regularly as a mouthwash, like diluted. And if you just use hypercal, is fine. I mean, calendula itself, it will be enough as a tincture, diluted tincture, but in a form of hypercal is perfect. So there are anesthetics and other things that you have during the dental procedures. So we might need to detox a little bit, especially sensitive people will feel it. So Nux vomica, phosphorus, and dental anesthetic in a form of the remedy might be useful for those situations. And you can do that, not necessarily immediately. You can do it a week later, 2 weeks later. No need sometimes. I mean, it really depends because our body has a capacity to detox. But if you need some support, that will be the remedies to help.
Especially if you have the MTHFR gene mutation, it's going to be much harder for you to detox from any sort of local or general anesthetics. So, it might be. And just taking like even a single dose of Nux vomica, if you're like, I'm not sure whether I'm affected or not, just take a single dose of Nux vomica. But also, like you say, we don't have to detox everything. Our bodies are amazing and it can heal itself. So yeah, just tune into how you're feeling. But certainly if you have MTHFR, you're probably more prone to feeling some sort of effects.
And what happens when we have a bleeding? There are top remedies for that. And calendula again, arnica, which you might already use right away, might prevent even the bleeding to happen, no? But sometimes bleeding might happen when following day, and if you see like this dark blood and clotting, benlakisis will be probably your top one. If there is a stream of blood and is bright red, then phosphorus will be your choice. But again, differentiation of the remedies, it might require some more understanding how your bleeding is. So there are options, but we just want to know a little bit more. And pain, that's often associated with post-extraction. Again, we can use big remedies like arnica and hypericum, which you might be already using, but specific remedies when you, for example, the pain is worse from cold water, rutagravolens will be the remedy. Or if it's such a neurological pain that you feel in your tooth, then you might consider Hecla lava. So yeah, it all depends how your pain feels and what does temporarily make your pain better or worse, because that helps to point to the right remedy. And that's hypericum calendula I mentioned, and we chat about just before. And yes, keep it quite regular. I normally tell my patients to just post-extraction to use even 3 times a day or after each meal, diluted 1 to 10 with water. And yeah, that will prevent your infection and increase your healing. And what happens if unfortunately the infection happen? We have remedies for that too. And the top ones will be belladonna, hypersulf, silica, merxol, sabesagria. And again, clams come to play where we want to know a little bit more. If you feel the redness, the swelling, the throbbing pain, the obvious remedy would be belladonna. If there is also already stage of the pus, you might need to go to hypersulf. Merxol will be like if you feel metallic taste, it's normally on the right side. And silica would be for the later stages of the infection. So again, we need some more information to decide which remedy, but that will be the top ones for the post-extraction infection. And what about the dosing? We normally say the dose is 1 or 2 pills, or 1 tablet, 1, 2 drops. The manufacturer is different, but I think from your remedies, you normally say 2 pills, no? As a dose.
2 pills, yeah. But I mean, you can take 1 or 10 at the end of the day. But
Take comfort, no?
Yeah.
Tropical, but I feel like, yes, some companies, sometimes they put 5.
I know, they take, I feel like they're pushing a little bit. It's probably not that much needed.
No, you doing your remedies manually, no? You medicate them manually, where company like Boiron, they would not do that. And spraying method. So they put a huge amount in one massive container and spray it. And let's say maybe not the whole pills are covered. So they covering their bags by saying 5.
Fair enough.
Like bespokely handmade remedies, 1 or 2 pills is enough. And then what potency I would see? I mean, 30 or 200 would be my go for. If it's something very intense and like bleeding or pain, yeah, you can go to 200. But if it's already not so intense, 30 is a good potency, around potency to use. And normally you might have it in your kit already at home. Infection, usually 30, but sometimes 200 also might be useful. But the golden rule is the most important thing is the remedy rather than potency. So if you only have 1 m of this remedy, I would use the remedy rather than thinking that, oh, I don't have that potency. Just use what you might have, because if you need to wait 1 or 2 days for the remedy to be delivered, the remedy might be very different then. So that's my take on that. And I feel like everyone feels similar.
Yeah, absolutely. Take what you have. If it's something like a 6C, you just might have to take a bit more of that. I find if it's quite an intense situation like an infection or like intense pain after extraction, like if you only have a 6C, then you probably going to have to use that quite often. But I find that if it's an intense situation and you only have like a high potency, that's, it'll definitely do the job quite well.
Yeah, the 6C will be used up very quickly by the body, no? So the repetition, and often then using water dose in a shaking in a bottle that can slightly increase the potency might be also a good idea to give you a better outcome. So this was mainly acute help, what Homeopathic can offer for dental surgery. But yeah, we look at the teeth in the whole consultation as well. And constitutional care is something that might prevent actual need for the extraction or issues with the teeth, and support the whole body, tooth and teeth, that they go through healing. So you might require less procedures with your dentist. So acutely, we can help with tooth abscess, tooth injury, tooth ache, tooth extraction or dental procedure. That's where Homeopathy can help you with acutely, but we also want to look the bigger picture beyond that. And that's just a simple case that I had recently with a patient that I was asked for help at the stage that it was already visited. The patient went to the dentist and they had some antibiotics prescribed because there was an abscess and the dentist wanted to do extraction. And the pain was there and lots of uncomfortable feeling on the side of the jaw. Couldn't speak, couldn't sleep. The pain was dull and overwhelming a little bit. But I was digging, like, when did it start? And the emotional state that actually contributed to flare-up of the tooth, which was decay tooth, but it was okay. I mean, it was still there hanging, was the frustration and anger because the patient was moving the house and they had some overwhelmed feelings and some anger with that situation because they couldn't decide what to take to the new house. And that's how a body reacts. Yeah, we have a weak point, like the decay tooth, which was there hanging, and then sudden emotional state that brought this and may cause the flare-up. So my prescription for that particular patient was Staphysagria 200, a bunch of cell salts to support the decay, and belladonna and hypericum for the inflammation and pain. Also, I prescribed some Bach flower essences, and he was a bit tired, overwhelmed, the change. So olive, aspen, walnut, and oak. And advised to use typical clash remedies, which is calendula, lidum, arnica, staphysagria, and hypericum if the extraction takes place. So first there was some improvement, then there was a downhill a little bit, but the patient was keep taking remedies, and eventually he was better and didn't need so much input from the dentist. And I think they didn't take antibiotics at the end. The swelling went down enough that the dentist could proceed with the extraction. So that was a win for the patient because he wanted to have an implant done there and use some arnica and hypericum post-extraction to help with the pain and the trauma to the jaw. And simple cases like that can really show that homeopathy is very powerful and can help. But we want to look beyond that. And often we might have issues with inherited weakness to the tooth. Tooth remineralization is a big one because already kids, babies, they start having dysplasia of the enamel, and that's already might be something to do with magnesium deficiency, iron deficiency, or other metabolic things genetically inherited that the weakness of the teeth is there. Because as much, sometimes, in the teeth group, we read the stories that we have great diet, a great hygiene of the teeth, and still there are issues. So where are they coming from? There is inherited weakness sometimes, and we can help with that as well homeopathically, with miasmatic remedies and looking where to support that weakness within the body. And with tooth remineralization, we recommend cell salts, and you have a great tooth mix, strong teeth.
That's actually saved one of my teeth that it should have been extracted about 10 years ago, but I still have that tooth in my mouth thanks to the strong teeth mix. And whenever I stop, I'll go through stages of not taking it for months and months, sometimes even a year I won't take it, and then I'll start feeling it coming back on, and then I'll just put the strong teeth mix in my water, and then, that'll work. Although I'll tell you what, after recently, we had Miranda Castro in the membership, and she said with the cell salts, not to put them in your water because they are biochemical. And then if you put them in the water, then it changes the solution, or then it doesn't act in a biochemical way anymore. Then it acts in a different way. So then I was like, wow, I've never heard that before, but it makes a lot of sense. So with strong teeth mix, it might be best to just use it as a spray or just use the pills just like that. But I mean, I've often just put it in my water and it still works, but it clearly just works in a different way.
Interesting.
Yeah. Well, it makes sense because, the soul cells, the way they've been made in a 6X is to have a biochemical action within the cells. Because I always call them tissue salts, but Miranda was saying it needs to be called cell salts because they actually have an action on the cell, which then obviously in turn has an action on the on the tissues. So we should be calling them cell salts, not tissue salts. And then when you put them in the water, then it doesn't have a biochemical effect anymore. It acts differently. And I was like, wow, I just hadn't heard that before, but it makes complete sense the way she said it. And she's been using them for 45 or 50 years, so she should know.
Yes. Oh, interesting. Yeah. And putting things in the water is often more easy,
Yeah, absolutely. Yeah, because otherwise you forget.
Yeah, you need to take 3-4 times a day just for the full effect. But you want to make your life easier, but it might be, would be nice to have a comparable study.
Yeah. That would be good.
Yeah.
A little while ago, I was so annoyed. There was a dentist that told her clients not to put the remedies in their water because it's bad for their teeth. I think I messaged you about that because I'm like, Jagoda is a pharmacist, if anyone knows, and a teeth specialist, if anyone knows, it'll be her. But I thought that was I couldn't understand the logistics behind it because there's 2 teeny tiny little pills that you're putting in 500 ml or a liter water bottle. There's no way they can damage your teeth.
Yeah, I feel like it's not damaging, but they like to blame everything else than really understand fully.
Yeah, anyway, I was just going to say that for our listeners, it's fine to put it in your water bottle. It's not going to affect your teeth. It's going to help it, if anything.
Yes. Let's face that the 2 tiny pills are not making such a difference when the foods that are having artificial sugars, because often the sucrose, and I'm sure yours also, is the organic sucrose that we use for the remedies.
Well, some toothpastes have sucrose in it. So then you also, going by that, probably shouldn't, brush your teeth.
No. Let's not go.
Yeah,
more practical. I would say be practical. Do what works for you.
Exactly.
So there is this Meridian connection that I touched a little bit at the beginning of the presentation. And that's the internal chart and the teeth connection. Whoever looks at the presentation.
Yeah, that's such a good chart. You can just go on Google and just type in teeth meridian chart and it should come up. I think that I've seen that particular picture that you've got. I think it's like from a chiropractor or it's like a TCM practitioner's website or something like that.
Yeah. And it's so useful to know, which organs and then what emotions you can connect with the organs, because often molars, the top molars and bottom molars are the main ones affected. And when you look at, let's say, left bottom molar and his lungs, and let's say someone had a just recent grief, and that might occur in the tooth itself, that sadness, that unexpressed grief. Or there might be some issues with large intestines, constipation specifically, might affect the tooth itself. So having that connection and understanding the relation with internal organs can really improve both the organ and the tooth, because you start working and supporting, let's say, liver or kidneys or large intestine or lungs, and then you have also results in the teeth itself. So, homeopathy can support on a constitutional level the teeth when we look at those organs connection, and because we also support the emotional state, and so then the physical state is balancing out, and the teeth is part of it, and like we want to take that in consideration when we look at the remedies. So yes, these teeth are not stones in your mouth, for sure. And the health of the teeth determines a lot the overall state of your health. We often see that, for example, post-pregnancy, because our body, if the body needs things like salts and minerals for development of the baby, and there's not enough in diet, where it's going to go from? It's going to go from bones and teeth becoming weaker during the pregnancy, because often those minerals are being pulled from there to develop the baby. So that's about that. And that's some links where you can find me if you have some questions or you want to have some more one-to-one chat.
Let's just read that out as well, because for those just listening, you can go to jagodahomeopathy.com and book a consult with Jagoda there. And you can also visit her Facebook. Well, it's a team of homeopaths. So Homeopathy for Teeth. So just facebook.com/groups/homeopathy for teeth. And she's also on Facebook. And are you on Instagram? Oh, yeah, Instagram as well.
Instagram, Facebook, and your group, Eugenie Homeopathy.
Yes.
So, we can connect somewhere in the socials, in the...
Yeah, and Jagoda does online consults. So wherever you are in the world, it's not an issue. She can help you, whether it's from Bali or Barcelona. Jagoda's there. She can help you anywhere. Oh, amazing. Thank you, Miss Jagoda. I really appreciate it. Is there any final words of wisdom that you want to leave us with?
Well, final words of wisdom would be take care of your teeth. We only have one pair, for the whole life. So we want to have them as long as possible. And just observe your symptoms before you see homeopath or anything, like the connections with your emotions. This way of thinking we try to spread. Hopefully people who want to use homeopathy, they start thinking this way, because it helps you in other spheres of life as well. When you bring this holistic approach. And with the recent studies showing how, normal painkillers can be toxic, like Panadol and so on, homeopathy can provide great alternative to those. Antibiotics as well are exhausted. Then there is a great risk of
antibiotic resistance.
Resistance. So using homeopathy can prevent you needing those, and really make the experience much more pleasant.
Absolutely. And when you're going to see Jagoda for your consult for your teeth, try to keep a little diary of the things that make the pain better or worse. Like you were saying, is it better or worse from chewing or swallowing? Is it better if you lie on that area or if you just leave it alone, if you're out in the fresh air or not? Is it worse in the morning or the night? Is there, do you want to put like a warm cloth on it or a cold cloth? Or is it only sensitive with cold or only sensitive with hot? Like, try to make a list of all these little things because it just really helps us find the right remedy for you.
Yes. The key is the modalities here.
And it really does make a big difference. Alrighty, homies. Thank you so much for hanging out with us. And if you hadn't thought, because amazingly, some people don't think of homeopathy for their teeth. If you haven't thought of using homeopathy or how it can support you in your procedure, having healthy teeth or just, whether it's an extraction or especially for your little kiddies, if you want to try and avoid, antibiotics and, pharmaceutical pain relief, homeopathy has an option. So book in a consult with Jagoda. You can actually do like a free discovery call with her as well if needed. I know from the amount of testimonials I've had of clients that have said that Jagoda's helped them, I can wholeheartedly vouch for her. So
much. And it was a pleasure to share this knowledge and homeopathy experience with you and with all the listeners. And thank you again for spreading homeopathy all around the world. It's like
always a pleasure, and always lovely to hang out with you, dear Jagoda.
Thank you.
See you, my friend. Bye.